Have you been told it's normal to wake up 3 times a night to use the bathroom after 60? Or that losing your potency is just part of aging? You probably wouldn't expect that these are not inevitable facts, but the result of common daily habits. For generations, men understood the connection between simple daily routines and lasting vitality, something modern life has caused us to forget, leading to issues that many now accept as normal. Recent research now confirms what wise men always knew: simple lifestyle adjustments can significantly reduce prostate inflammation and restore comfortable function, a fact many men are completely unaware of. I'm Dr. Sarah, and I'm tired of seeing men suffer in silence. I want to share crucial information about prostate health that can make a real difference. Subscribe now because this information combines forgotten wisdom with practical daily steps every man over 60 should know. Before we start, let me know where you're watching from today. If this is your first time here, please subscribe for more essential men's health insights. Great to meet all of you today. I can see from your comments that we have men watching from all across the country, some from small towns, others from big cities, and many of you hard-working folks who've spent decades keeping America moving. Now, let me give you a clear roadmap of what we'll cover today. First, I'll share the surprising science behind why these nighttime wake-ups happen and what your body is actually trying to tell you. Second, we'll explore 3 major categories of daily habits that research shows directly impact prostate inflammation, and I promise these will be things you can actually control. Third, I'll address the real-world challenges many of you face, especially those in demanding professions like truck driving, because practical solutions only work if they fit your actual life. Let me start by sharing Robert's story. He's 68, a retired electrician from Pennsylvania who worked construction sites for over 40 years. Robert came to me already working well with his urologist. What he wanted was to understand why he was waking up 3 times every night, even though his PSA levels were normal and his doctor said everything looked fine structurally. I coordinated with his medical team, and together we identified several daily patterns that were creating unnecessary inflammation. Within 6 weeks of making these adjustments, Robert noticed he was sleeping through the night most evenings. His urologist was pleased with his progress during the next checkup. Today, Robert continues both his regular medical monitoring and these natural approaches, feeling like he got his rest back. Here's what happens when inflammation affects your prostate. Your prostate sits like a walnut-sized guardian right below your bladder, surrounding the urethra like a protective tunnel. As we age, this tissue naturally becomes more sensitive to irritation, which is completely normal. However, certain daily habits create ongoing inflammation that makes this walnut-sized gland swell and press against that tunnel, making it harder for your bladder to empty completely. What that means for you is that small amounts of urine stay behind, irritating the bladder and creating that urgent feeling even when there isn't much to release. The wonderful thing is that reducing this inflammation works with your body's own healing wisdom, not against it. Let me share the research that changed how I approach these concerns. Studies from respected institutions, including work published in major medical journals, show that simple lifestyle modifications can reduce prostate inflammation markers by 20 to 40% within 8 weeks. The science is encouraging, and the real-world results speak for themselves. Now, let's examine these daily habits, starting with the ones that might surprise you most. The hydration contradiction. Many men tell me they stop drinking water after dinner because they're afraid of more nighttime trips to the bathroom. This creates exactly the opposite effect they're hoping for. When you're mildly dehydrated, your urine becomes concentrated and acidic, which irritates both your bladder and prostate tissues like salt in a wound. Think of your urinary system like a gentle river that needs to flow clean and clear. When that river becomes a stagnant pond, problems multiply. Research shows that men who maintain proper hydration throughout the day actually experience fewer urgent episodes because their urine is diluted and less irritating. What to expect? Most people notice less burning and urgency within a week of proper hydration. The key is drinking steadily through the day rather than large amounts at once. Your goal is pale yellow urine. That's your body's way of saying the concentration is just right. The sitting trap. Here's something that affects nearly every man I counsel. Too much sitting creates a perfect storm for prostate problems. When you sit for hours, blood pools in your pelvic region, creating inflammation and pressure exactly where you don't want it. Your circulatory system works like a pump that needs movement to function properly. Sitting for long periods is like putting a kink in a garden hose, everything backs up. Research from UCLA shows that men who interrupt sitting every 30 minutes with just 2 minutes of movement reduce urinary symptoms by 12 to 20% and report better energy levels. I know what some of you are thinking right now, especially our professional drivers. Frank, a 65-year-old long-haul trucker from Ohio, brought up this exact concern during our consultation. He said, "Doc, I can go over an hour between truck stops. I can't just pull over anywhere." Frank and I worked together with his doctor to develop what we call seated circulation breaks. These are simple ankle rotations, shoulder blade squeezes, and pelvic tilts that can be done while driving safely. We also explored strengthening exercises for his pelvic floor muscles, the same muscles that help control urination, which gave him better control during those unavoidable long stretches. Within 3 months, Frank noticed he could make it more comfortably between stops, and his nighttime symptoms improved significantly. His doctor was impressed with how well Frank had adapted the general principles to fit his specific work demands. The caffeine connection coffee and tea are more than just morning rituals for most men. They're lifelines that help you feel alert and ready for the day. However, caffeine acts like a direct stimulant to your bladder and prostate, increasing urine production and making it harder to empty your bladder completely. Research from systematic clinical trials shows that caffeine affects sleep quality in men over 60, and poor sleep actually increases inflammation throughout your body, including your prostate. Men who reduced stimulants after their morning cup improved their sleep efficiency by up to 25%. The solution isn't eliminating your morning coffee, it's about timing and moderation. Enjoy that first cup, then transition to herbal teas or decaffeinated options. Many men notice less urgency and better sleep within 2 weeks of this simple adjustment. Let me address another major category of habits: what you eat and how it affects inflammation in your body. The processed food problem. Modern convenience foods contain preservatives, excess sodium, and unhealthy fats that your body treats as irritants. These substances trigger inflammatory responses that affect your entire system, including your prostate. Research from large population studies shows that men who eat diets rich in fresh vegetables, fruits, and nuts experience 30 to 40% fewer inflammatory markers and report significantly better prostate symptom scores compared to those eating primarily processed meats and packaged foods. Think of food as information you're sending to your cells. Processed foods send messages of stress and inflammation. Fresh, whole foods send messages of healing and balance. This doesn't mean you can never enjoy a burger or pizza, but making fresh foods your foundation gives your body the tools it needs to manage inflammation naturally. Charles, a 71-year-old retired accountant, was skeptical about dietary changes until his wife Margaret started preparing more meals with fresh ingredients. Within 2 months, Charles noticed he felt less bloated, had more energy, and wasn't waking up as often at night. His doctor noted improvements in several inflammatory markers during his routine blood work. The spicy food factor. Heavily spiced foods, especially those with hot peppers, create direct irritation to your urinary tract tissues. While many cultures include spices for their health benefits, extremely hot foods can trigger immediate symptoms in men with sensitive prostates. This doesn't mean eliminating all flavor from your meals. Herbs like turmeric, ginger in moderate amounts, and garlic actually have anti-inflammatory properties that may help reduce prostate irritation. The key is distinguishing between flavorful foods and those that create burning sensations. Now let me share something that might be the most important habit we discussed today. Never ignore your body's signals. When your body tells you it's time to urinate, that's not a suggestion, it's essential communication. Holding urine creates direct pressure on your prostate and can lead to bacterial growth in stagnant urine. I understand this advice sounds simple until you're in the real world. David, a 66-year-old who drove delivery trucks for 35 years, used to hold his urine for hours during busy routes. He developed what doctors call retention habits. His bladder and prostate essentially forgot how to work together efficiently. Working with his urologist, David learned pelvic floor exercises that strengthened the muscles responsible for urination control. He also planned his routes around available restrooms and learned to recognize earlier signals from his body. These changes took patience, but David regained much better function over several months. For men in professions where stopping isn't always possible, the solution isn't ignoring the problem, it's building better muscular control and planning ahead when possible. Your doctor can teach you specific exercises that strengthen the muscles involved in urination, giving you better control when you must wait. The smoking connection: tobacco use, whether smoking or chewing, delivers toxins directly into your bloodstream that damage blood vessels throughout your body. Your prostate relies on healthy circulation to function properly and manage inflammation. Research shows that men who quit smoking see improvements in urinary symptoms within months as their circulation improves and toxin levels decrease. Even exposure to secondhand smoke can contribute to inflammatory processes that affect prostate health. Weight and inflammation. Carrying excess weight, particularly around your midsection, creates a state of chronic low-level inflammation throughout your body. This inflammatory state affects hormone balance and puts additional pressure on your pelvic organs. Studies indicate that even modest weight loss, as little as 10 to 15 pounds, can reduce inflammatory markers and improve urinary symptoms. The goal isn't dramatic weight loss, but rather achieving a weight where you feel comfortable and energetic. Stress and your prostate. Chronic stress floods your body with cortisol, a hormone that promotes inflammation when elevated long-term. Men who experience ongoing work stress, financial worries, or relationship difficulties often notice their prostate symptoms worsen during particularly stressful periods. Simple stress management, whether through regular walks, time with family, hobby activities, or prayer, helps regulate cortisol levels and reduces overall inflammation. Many men notice improvements in sleep and urinary symptoms when they find healthy ways to manage daily stress. The importance of regular checkups. Skipping regular medical appointments might seem unrelated to daily habits, but it's actually one of the most harmful patterns I see. Early detection and monitoring allow you and your doctor to address concerns before they become serious problems. Your doctor can track changes in your symptoms, adjust medications if needed, and recommend specific treatments based on your individual situation. Regular checkups also help you understand which lifestyle changes are working best for your particular circumstances. Let me share what the latest research tells us about natural support for prostate health. Studies from respected medical centers, including work published in Preventive Medicine, show that certain compounds found in pomegranate juice have powerful antioxidant properties that may support healthy circulation and reduce oxidative stress in your body. Similarly, research indicates that moderate amounts of ginger may support healthy blood flow. However, it's important to remember that these are supportive approaches, not replacements for medical treatment. If you're taking blood-thinning medications or have bleeding disorders, please discuss any dietary supplements with your doctor before making changes. Here's exactly how to begin making these improvements. What you need. Start with just 1 or 2 changes, rather than overwhelming yourself with everything at once. When to start. Choose changes that feel most manageable for your current situation and daily routine. How to begin. 1. Add 1 extra glass of water during your morning routine. 2. Set a phone reminder to stand and stretch every hour. 3. Switch your afternoon coffee to herbal tea for 1 week. What to expect. Most men notice subtle improvements in energy and sleep quality within the first 2 weeks. Urinary symptoms typically improve more gradually over 4 to 8 weeks. Remember, consistency matters more than perfection. With your doctor, mention these lifestyle changes during your next appointment. Your doctor can help you track which approaches work best for your specific health picture and make sure nothing interferes with any medications you're taking. The wonderful thing about these approaches is that they support your body's natural ability to manage inflammation and maintain healthy function. You're not fighting against your body, you're giving it the tools it needs to work optimally. Let me address those of you in challenging professions directly. I've worked with truck drivers, pilots, factory workers, and men in many demanding jobs who initially felt frustrated because standard health advice didn't fit their reality. The key is adaptation, not abandonment of good principles. If you're a driver who can't stop frequently, work with your doctor on pelvic muscle exercises that give you better control during necessary waiting periods. If your job requires long periods of sitting or standing, focus extra attention on the movement and circulation strategies we discussed. If your schedule makes regular meals difficult, concentrate on staying hydrated and choosing less inflammatory foods when options are available. Your health challenges are real, but they're not insurmountable. Every small improvement adds up over time. James, a 69-year-old retired postal worker, summed it up perfectly during his last visit. He said, "Doc, I thought getting older meant accepting more problems. Now I realize it means getting smarter about taking care of myself." That's exactly the mindset that creates lasting improvements. You're not victims of age, you're experienced men who can make informed decisions about your health. The most important message I want you to remember is this: small, consistent changes create significant improvements over time. You don't need to transform your entire life overnight. Pick the 1 or 2 changes that feel most doable right now. Stick with them for a few weeks, then gradually add others as they become habits. Your body has remarkable healing abilities, even in your 60s, 70s, and beyond. When you reduce inflammation through better daily choices and work alongside your medical team, you're giving yourself the best possible chance for comfortable, confident aging. If this approach resonates with you, I'd love to hear about your experience with making these changes. Share your story in the comments below. Your experience might help another man who's dealing with similar concerns. What questions would you ask your doctor about these lifestyle approaches? Comment below your questions. Help me create better content that addresses your real concerns. Before we close, let me share one final thought. Many of you have spent decades taking care of others, your families, your employees, your communities. Now it's time to apply that same dedication and wisdom to taking care of yourself. You deserve to feel comfortable, rested, and confident in your own body. In next week's video, I'll be sharing specific exercises and techniques for the profession-based challenges we discussed today, including detailed guidance for men whose work makes standard health advice difficult to follow. These will be practical, tested approaches that real men in demanding jobs have used successfully. If this information has been helpful so far, please subscribe so you don't miss these targeted solutions. And if this reminds you of a friend or family member who might benefit, please share this video with them. It might make a real difference in their quality of life. Thank you for trusting me with your health concerns. And remember, taking care of yourself isn't selfish, it's essential.